Hi, I'm Amber. I am one of Dr. Kratchmer's nurses, and I am going to talk to you today about body lift surgery. So body lifts are increasing in popularity largely because of everybody's weight loss with the injectable drugs like Ozempic, Moderna, Wegovy. And what happens is patients that were overweight will lose the weight and end up leaving the skin behind. Well, the skin can interfere with just your regular activities of daily living. So, just being able to bathe and shower and move around and continue exercising when you're holding on to a lot of excess skin is a problem. So, body lift surgery is all kind of encompassing in several different, it's a general term for several different procedures. So we have a body lift form that we may use if a patient is doing buttock lift, if they're doing a panniculectomy, which is kind of like a tummy tuck, except with the panniculectomy only the skin is removed, there's no muscle repair. That's rare, we don't do that often. We usually do the tummy tuck with the muscle repair. Thigh lifts, arm lifts, all of those areas that are skin removal, but may or may not really have that much to do with the muscles. So it's just all those are our most common ones. And that's a lot of what we're seeing now. I mean, we've seen them a lot, but it's very, very predominant now that those medications have been out for a while and people are hitting those stable weights and they're ready to do something about the skin. Now, when we do that surgery, we do want you to be at a stable weight. We don't want you to be actively losing, because you'll go through all this time spending all this money and energy and recovery to remove skin, then lose weight and need to do it again. So we want you to get to the point that you're at a stable weight for a few months and then you're ready. So it's not a weight loss procedure. It's not going to take the weight off of you. It's going to remove the skin after the weight loss. Now, there are different techniques that are used. Sometimes it's just the skin removal, and then sometimes we incorporate a little bit of liposuction in some of the areas to help with the contour. So when you do your surgery, if you have the skin removal and you have liposuction, you're probably going to be more sore, honestly, from the liposuction that was done than the skin removal, because the skin removal, he cuts, we cauterize those blood vessels, and sew you back up, and your incision is just so numb for a long time that you don't really feel that much. But you can feel the liposuction is probably more painful. It feels like a real kind of deep bruise as far as your recovery goes. If that happens, you're going to have a different set of instructions. So I have another video for post-op liposuction, but right now this one's going to be pretty quick as far as the skin removals, because there's just really not that much to go through with you. One thing that I do recommend that's great for the skin removals is, if you're interested in having a more long-term pain relief, the Exparel is really great for that. What it is it's just a longer acting anesthetic. So kind of like, imagine having lidocaine in your skin for 3 days. That's kind of what it is, except it's a different, it's similar to lidocaine. So when you come in, if you have Exparel, we give you one of these nifty bands that you're gonna wear home. And what this is telling you is, hey, if you have any complications or any other procedures, if you go and have treatment anywhere else, at a hospital or anywhere else, this is saying, we've given you a long-acting anesthetic, so you can't have another anesthetic within 96 hours. So this is on you. After 96 hours, after your procedure, you can go ahead and remove this, because that means that anesthetic is out of your system. The biggest thing that we have to deal with body lift surgery post-op is just the delayed wound healing that is possible. And then later on, you have a higher chance of needing some type of revision. The reason for that is when you have weight loss, when your skin is stretched, it damages the skin, and that may be evident by stretch marks that you can see visually, crepiness, a lot of sagging lets us know that there's not enough elasticity in the skin. So when we come in and we remove the skin, we lift things up, the skin sometimes is just not strong enough to counteract the weight of, say, something below it. So it can be weighed down again. So what we have happen with some of our bigger weight loss success stories is just the fact that they come in and have their surgery, and then a few months, 6-9 months later, we have to revise it. It's to be expected. We do have our revision policy, so all you're paying for when that happens are just like facility fees, supply fees. The price is pretty minimal when you do that, if you follow the revision policy, which there's another video on that. The other big thing is just the delayed healing that you can have. Sometimes patients have underlying conditions like diabetes or blood pressure, things that can just cause delayed healing. So if you have delayed healing, then you are more likely to have breakdowns in the incision line. So delayed healing means when we cut through the incision, we're cauterizing the blood vessels as we go. That way, when it heals, we cut out a big piece of skin, and we need the blood vessels from up here to now connect to the skin from down here, wherever they lined up when we took this big piece out of the middle. So when we sew it back together, if it's here, it's got to find its way back. All of these little connections have to make. For that, we need good blood flow, we need good blood supply. If we don't have good blood supply, then you'll start to, some of the tissue and some of the skin along the incision line can die. It's called necrosis. If that happens, we pack it, we debride it, we just help along the healing. But again, the healing, it heals, it's just delayed. It takes longer than normal. Things that we can do to prevent delayed healing are taking in a lot of protein, and then just making sure that we have good blood flow to the area. You're wanting to walk, take deep breaths, things like that after your surgery. Now, as far as sorry, I lost my train of thought. I do these videos at the end of the day and I'm tired, and I apologize. So to keep good blood flow, we want to prevent cutting off the blood supply to the incision. So if we have, say we did the arms and we have an incision, a brachioplasty, which is an arm lift, if we have an incision here where we removed skin and this incision's coming here, if we compress, which we do because we want to help move the fluid. We don't want fluid collecting, in the tissues. So we compress it so that the fluid won't stay in the tissues. But when we compress, we have to make sure that we completely cover the area that we treated. If we only put a compression garment, if our incision is here and we have a compression garment coming to here, then we're pushing down on this incision and we're cutting off blood flow to the parts down here. So when you have your garments on, it's really important that they don't cut you off, that they completely cover the incision. The arms, when we do brachioplasty, the arms are probably the procedure that the patients complain the most about as far as being painful and uncomfortable, because the incision does come here and it comes into the arm, just kind of right under the arm, and it's hard to it rubs because you use your arms a lot, and it swells. The garment is uncomfortable because, you know, it can't be super tight around your chest. It comes up and it comes around, and it's just not a comfortable garment. It's the same garment that we use for arm lipo, so it's the same complaint. It's just, we have to have it because it completely covers. Other things that you can wear instead of that garment would be something like an Under Armour. If it was not too tight, we don't want it super tight. You should be able to put your hand in there, but tight enough that it just keeps you from holding on to all that fluid. When we have the garments that come here, what happens is the patients will complain that their hands are swelling. My hands are swollen up because of this garment. So when that happens, we just have you take the garment off for a little while. Elevation helps. It's hard to sit there with your arms elevated. So again, that's just a really difficult area, but you can take it off for a little while to just let the fluid move. When we make incisions, we're not only cutting through the skin and the blood supply. You have to remember that we're cutting through the body's lymphatic drainage system. So it's just not able to move the fluid through the body as it did before. So these are just some of the things that we're battling when we are doing this. That's another reason I'm just going to take a moment to say that there's a lot of talk about these post-op lymphatic massages, things like that. That is why the lymphatic massages really aren't that beneficial to you after this type of surgery. They're great for after liposuction, but not when you have an incision, because the incisions like that cut off that system. So really the fluid's not able to, you know, go where it's supposed to go until those connections start to heal. When you have those massages, you have to, you know, worry about putting your weight on the incision, what position they're going to put you in. We can tell, actually, usually when we have incision openings, we can tell when they're from massages because they're in different places than the skin would normally lose its connection. So anywhere that there's, like, say you have a vertical tummy tuck, if it's vertical, and, you know, across, anywhere you have like a T where there's 3 pieces of skin coming together or 4 pieces of skin coming together, you can tend to have a little bit of a breakdown there. So those kinds of things are normal, but to just see it start breaking down on the side isn't really normal, and that's what we see a lot with people that get massages. So really just be patient. The swelling will go away. The swelling is not going to stay with you forever. It's, you know, a few weeks to kind of deal with just that annoyance, the discomfort. You're wearing your garments, we're monitoring you, and that's really the best thing to do. Another area that we do for body lift, so we do the arms. Another area that we do is the upper back, so it's the bra line incision. And that one, it seems that you would think that it would be very similar to a tummy tuck recovery because the incision is that long. You know, it's across the back. We hide it into the bra line so that when you wear a bra or a bikini top, it's not visible. That's another reason why you should wear your undergarments to your surgery, so that we could hide that line. Now, that line is long, but we're not doing any muscle repair, so we're really not going deeper than the skin and the fat layer. So as far as recovery wise, patients handle that one really easily. I see patients come in getting right back to their activities and things like that pretty quickly after that, much more so than even the arms, just because of it's numb, they don't really feel it. That's another really good one for Exparel. I mean, you could really numb up that incision well to where you don't feel it. I would say Exparel also for the brachioplasty, because that's just the one that the patients struggle with the most. Probably out of all of the procedures that we do, I would say the brachioplasty is probably one of the more annoying ones to recover from, just because it restricts your arm movement so much. So the upper back lift, out of, sorry, I can't talk. From these surgeries, post-op, you're gonna go home, you are sutured up. A lot of times he will use a few little skin staples kind of first, and then he'll go in and suture the layers of the skin. So, and then we put on Steri-strips, so they look like flesh-colored Band-Aids. And then we put on some gauze, and then we put on your garment, or whatever you're gonna wear. So you will go home, and then you rest the first night. The next day, you are going to start your dressing changes. So clean, dry dressing changes once per day, twice per day, depending on what you're draining. You will have a drain, but it's called a Penrose drain. And it looks like a thin, flexible straw with the holes on the end. So it's not like the JP drain that has the bulb. This is just kind of like a straw under the skin. And it's not sewn into your incision. People get nervous that it's gonna hurt to have it removed. It's placed, and then the skin is sewn on top, and then we leave a little hole so that when it's ready to come out, we just kind of pull it out, and your incision's fine, and your incision's numb and it's fine, and it's not as crazy as it sounds. But you are going to keep an extra pad over that hole. So on the upper back, you may have this little kind of, looks like a little plastic piece or something. It's flexible, it's soft, and it just lays right there. So you're gonna take some gauze and you're gonna just keep it covered. With the Penrose drains, we don't measure the output like we do with the JP drains. We don't have as much fluid coming out of those, so you're just really changing out gauze pads. Maxi pads also work really well for that, and they actually help stay inside your garment. So starting the next day, you take your garment off, you take off all that gauze, you leave the Steri-strips on. Those are the flesh-colored Band-Aids. They kind of look like masking tape. Those stay on for 2 weeks. At your 2-week mark, you're going to take a shower while they're wet and peel them off, and then come off like a breeze. If they start to come off before that, if they're starting to lift on the corners, just cut it off. That way you're not pressing dirty tape on your incision the whole time. So if it starts to come off, just cut it. The Steri-strips, when you're looking at them, as you're doing your dressing changes and things, you may see it's a little bit transparent, so you can kind of see through it. You may see little openings and things like that. That's fine. If the Steri-strip hasn't come up, it's fine to just leave it. Don't worry about it. If the incision's open, we'll see it at that 2-week mark. And again, it's just skin that's opening a little bit, and that's okay. So you can start showering pretty quick. Maybe like, oh wait, I'm sorry, I'm lying. You hold that thought. You're going to be doing sponge baths while you've got an opening, while you have that Penrose drain. What you can do is you can cover it, and you can kind of waterproof it. What I've done is I've taken that transport tape, which is that clear like plastic medical tape, the kind with all the tiny little squares on it, not the paper tape, but the one that's white. And you could put a piece of gauze, save my drains here, you could put a piece of gauze and you could tape it until it is completely waterproofed. And then you can get in the shower and you can kind of shower with a handheld or something like that. When you get out, take that off, use a hairdryer on low, not hot, but just low, and dry your Steri-strips. And if they're wet, they dry pretty quickly. And make sure everything is dry before you put everything back on. We don't want to get water in where the drain tube hole is. When I tell patients, yeah, you can shower if you waterproof it, I had a patient come in one time, and I really didn't mean every single day. I meant when you get to that moment that you just really, really need a shower and you cannot go another day without showering, this is all you can do, then waterproof it. Like I said, get in the shower, take the fastest shower ever with the least amount of water getting in those areas as possible. Get out, dry everything off. Really, sponge baths are the best until you get the drain tube out. Once you get the drain tube out, which may be a few days, it may be a week, then you can start, the day after you get the drain tube out, you can start showering like normal. So you get it out, we wait about, it takes about a day to close, and then you can start showering. That doesn't really apply to the JP drains. The JP drains, which we may use if you have like a panniculectomy, those, you could shower with the handhelds if you're sitting in your shower on a bench or something like that. But those, we just really want to try and keep them as dry as possible. Then, in those you have in a little bit longer, you know, those sometimes you can have them in for a couple weeks. So they're not as quick as the Penrose drains. And they're not as easy to cover as the Penrose drains. The Penrose drains, because there's no bulb, you can pretty much cover them completely. But the JP drains, you still have the tube hanging out, so you're still gonna, you can try and waterproof it as much as you can, but you can't quite do it the way you can with the Penrose drains. If you go home with a catheter, then you can take your Foley catheter out the next day. Most people, well, if you're doing arms, if you're doing back, probably not. We use the Foley catheters if your surgery is 2 hours or more, then we'll use that. Okay, so we talked about the arms, upper back. Another area that we do a lot of times with the body lifts are the thighs. The thighplasty, which lifts the upper thighs. The incisions for that go kind of like, you know, we pull up, so the incisions are right along the bikini line. And again, we'll have the same Penrose drain. So you're gonna keep the Penrose drains typically more to the front though. So you'll take your pad, you'll cover that up. And if you don't have drains, if he does not put a drain in you, don't worry about it. Don't feel like something's off. I will say that he usually uses them, but you know, I can't say for certainty that everybody will have one, depending on, you know, the amount of drainage that we expect. So if you get home and your incision is completely closed and you don't have a drain, then don't worry about changing out the pads and things like that. If your surgery is just your incision, congratulations, you can start showering the next day. The thighs, so again, same thing, same process as just, you're gonna have your garment. You wanna make sure that your garment is not too tight, that you can still fit your hands through there. You don't want your garment cutting you off at any point. On the thighs, if you're wearing a garment here, the blood supply is coming from up here. So when we say it can't cut you off, you can't wear this kind of waistband. You actually have to have a waistband that comes all the way up to here, because that's where your blood supply is coming from. So from here and then all the way down to like your knees. You're gonna notice that anywhere outside of the garment area swells, because the garments do a pretty good job of keeping your tissues compressed, so it's not letting the fluid collect there, so it may collect lower. So you may end up with swelling, you know, down here, your ankles, your feet, whatever. That's a good one. That's an easy one when you're at home resting. That's an easy one to put your feet up, to just elevate your feet, help with some of that. You can take your garment off, you know, for a little while and put it back on. Again, this is not liposuction. With liposuction, we need the compression on the tissues to prevent the fluid from staying in the tissues, because we made little holes in the tissues with the cannula. So we've gone in. Your body's response is to want to fill those little holes with fluid and hold on to it. So we use the garments to compress that. That's not an issue when we're just doing a skin removal incision. So we're not needing necessarily, we don't have to have those garments tight to achieve a good result. We're just have it just enough that you are a little bit more comfortable. Just enough to help push that fluid out. So don't feel like it's the end of the world if you need to take your garment off for a little while. You will feel better. You know, you can sometimes feel better with it on if it's a little bit tight, that, you know, you don't feel like you're moving, your tissues are moving as much when you walk. It kind of helps you feel a little bit better. But after surgery, you always swell up the day or two after. So sometimes the garment we put you in may all of a sudden be too tight, and now it's uncomfortable, now it's digging, and now you've got all this swelling, you know, now your ankles are swelling. So that's fine. If that happens, just back off on the garment a little bit. Just take it off for a little while, loosen it, do whatever to just make you comfortable. It's not going to ruin your result. The other area, so the thighs, again, same thing, clean, dry dressing changes. If you have the Penrose drain, change out the pads, Steri-Strip stay on for 2 weeks. Once you get the drains out, you can start showering normal the next day. Same instructions. Buttock lifts. So there is a, you know, it's not like a BBL, the Brazilian butt lift. That's totally something different. That's where you liposuction out the fat and then you turn around and you transfer it to the buttocks. There's a different procedure, which is a skin removal procedure for patients that are post-weight loss, and that buttock lift is a little different. Sometimes it's incorporated at the same time as a tummy tuck, and it's called a full circumferential tummy tuck. So basically, normally a tummy tuck is hip bone to hip bone, but we can bring that around and go all the way around, and so you have an incision here that's pulling up the buttocks. So that, again, people would think like, oh, it must be very similar to a tummy tuck, but it's really not, because again, there's no muscle repair, it's only skin. That's one of the harder ones, not really to recover from, not because of pain. That's a harder one to recover from just from positioning, because you want to sit, and a lot of times patients will open their incisions from sitting. It also is one that, because again, you have very weak skin sometimes after you have a weight loss. You know, once you have the fluctuations in your weight, your skin is stretched and then small, you lose the elasticity. So that is one, because everything's so heavy, that when we bring this back up, that's one that sometimes we have to revise, sometimes we have to do it again, because it just sinks. Sometimes with weight loss patients, we will bring everything back up, we'll cut out skin, we'll sew skin back together, and then we sew it back together, and then the skin gives out. So we have to revise. When we do revisions, the one that, if we have to do revision, say your upper back, say you did your upper back lift and it didn't hold. If we have to do the upper back lift again, it's like the whole procedure again. It's like the same thing that you went through, the whole thing all over again. When we revise other areas, like, you know, say we revise the brachioplasty, say we do a skin thing here, a lot of times those are little areas of skin. The upper back one is usually the same procedure again. The lower back one, or the buttock lift, can be also, but a different technique is done when he does that procedure, as far as how he lays the tissue, so it helps it out a little bit. But again, this video, it's the same when you're doing these skin removals. They're very different. They're different on the parts of the body, but the recovery from them is the same as far as incision care. Don't use any Neosporin. Triple antibiotic. Neosporin can barely heal a bug bite. It's not going to heal a surgical incision. But what can happen is if you keep putting these antibacterial things on your incision, it's going to kill all the bacteria, the good bacteria and the bad bacteria. And if you kill all the good bacteria, then you're going to have a place that fungus can flourish. So you'll get these fungal infections. So you'll have very red, itchy rash develop from that. So we are on board with letting your body heal as much as it can. So we're just supporting your body going through that process. We're doing clean, dry dressing changes. If you have any of these little areas that open up, we're still doing clean, dry dressing changes. Sometimes he may have you, stuff it with some gauze. That way when you pull it out, it's debriding it. But we guide you along with that as that happens, if that were to happen. Let's see, clean dry dressing changes, your garment, what am I missing? Your drains, scars. So you will want your incisions to heal first before you start any kind of scar treatment. We don't want to start putting the ointments and things on your incision. Your incision is not considered a scar. That word doesn't change until 9 months. It takes 9 months for an incision to be considered a scar. So you have all that time to come in with your silicone products to help reduce the appearance of scars. We don't need to start that right away. First and foremost, we want your incision to heal. After that, once it's healed, like about a month or so, then you can start using those scar gels and things like that. If you have any type of, drainage is normal. If you have drainage that starts to get thick, like toothpaste, if it smells, like that thick consistency, like lotion, consistency, and it has a smell to it, we want to know right away because that can be a sign of an infection. Fluid that's coming out that's very clear, no matter what color it is generally okay. If you have areas that start to turn red and swollen around the incision line, we want to take like a pen or a marker and trace, the outline of that to watch it. You're still going to let us know, but also trace it. That way we can see if the redness is spreading outside that line and see if we have any type of cellulitis or things like that that's brewing. Sometimes patients will send us a picture of their skin that's red, that's, it's red, it's hot, it's red. And Dr. Crashmer a lot of times can look at it and he'll say, what they put on there? You can tell that it's that fungal infection brewing. So sometimes it's hard to see. Sometimes I have to make a patient come all the way over so that we can take a look at the incision. That's another reason to avoid those antibacterials, because we don't want to question, why is it red? Did they put something on there that's making it red? If it's red, we want to act on that it's red, and we want to know that it's red and it's something that we need to do. We want you up and walking after your surgery to prevent blood clots and pneumonia. If you start to run a little bit of fever, like 99, 99.9, less than 100.5 after your surgery, usually that's that you're not taking enough deep breaths. It's common because, you're hurting, it's tight, you don't want to breathe in that deep. So that's just a common thing that can happen when you're not taking deep enough breaths. So if you call me the night of surgery, I'm not thinking infection, because infections take a long time to fester, and you're not really going to react to, even if you were to get an infection in surgery, you're really not necessarily going to react to it that night. Bacteria takes time to develop. So we give you antibiotics in your IV while you're asleep, and then we send you home with antibiotics. So that's another reason it'd be very difficult for you to develop an infection from your surgery and react to it that evening. So when you call and you have these fevers, a lot of times that's what we direct you to do. Get up and walk, or if you can't do that, take deep breaths, move your legs around. And a lot of times that will alleviate it. Sometimes surgery, because it can kind of, your body's focusing all of its energy on healing, it can leave you open to, catching viral illnesses more easily, things like that. So it's just, if you're having a fever, if it's above 100.5, it's in your instructions to call us so that we can, evaluate that better. If you have, let's see, I'm just reading through right now the instruction, or the important consent for body lift surgery. So sometimes people will call and they'll say, why am I getting a body lift surgery consent? This consent covers all of those procedures that we talked about: the upper back lift, the buttock lift, the arm lift, the thigh lift. That's what this is. It's lifts on the body. And the reason that they're grouped together like that is because the post-op instructions are, for us anyway, are very, very, very similar. We will send you home with, pain medicine. Your diet is not restricted after your surgery, but you want to start off small and gradually increase that, like that evening. You need to get food in your stomach before you take your pain medicine, because the pain medicine will make you nauseous and you don't want to be thrown up. Our anesthesiologists do an amazing job with starting to give you nausea meds prior to even waking up, and that keeps you from just getting nauseous. I can't tell you the last time I saw a patient that was nauseous, and I really think it maybe 1 to 2 a year come out of surgery nauseous, because they just do such a good job with minimizing that with medications when you're coming out. Some patients will say, I always get nauseous, but we do a little bit, I feel like we do a little bit more for our patients coming out of surgery, because, we try and give you a better experience. So just because you were nauseous at the hospital doesn't mean that you're going to be nauseous here, because we give you meds. Okay, so smoking, you need to make sure that you're not smoking for this. If you're a smoker, you need to quit. This is one of those things, it's a lot of blood vessels going through there that we need to reconnect for you to have a good result. And if you're smoking, you are going to limit the amount of oxygen in your blood and to make it a little bit harder for those vessels to connect back together. If they can't connect back together, then the skin is going to die, and that's where you're going to get the necrosis happening. We want you walking as soon as possible. We don't want to see you coming in a week follow-up with your walkers and things like that. We want you actually getting up and walking, but we don't want you to fall. So if you feel like you're unsteady, you need to make sure that you have somebody with you. If you feel like you're unsteady, then you can use the walker to just steady yourself, but not to put your weight on like you're using it as a crutch. We don't want that. We want you standing up. You will not be able to lift anything heavier than 5 pounds for 6 weeks. You can go back to work light duty when you feel like you can drive. When you're not on the pain meds and you can get in the car and drive. If you have a job that has a light duty assignment for you, that's great. If your job does not have a light duty assignment for you, then they will tell you that. Compression socks are great to wear after surgery. The TED hose, the ones that prevent blood clots, DVT, those are really great to have and to wear, but you can, you really only need them until you get up and start walking. So if you're laying around, no fajas until you're cleared by Dr. Cratchmer. Again, really you don't have to worry about that unless you're doing some type of lipo. We do give you the garments that you need, or we will tell you when you come to your follow-up appointments what you should get or switch to. You don't have to go buy a bunch of things before your surgery. The steri strips will stay on for 14 days. You'll take them off at 14 days. I think I already said that. When you shower, wait till your skin is wet and they'll peel right off. You're going to be numb for many, many months. Whatever numbness you have at a year is likely to be permanent, but you're going to be very, very numb for months. And certain spots you may have numb spots. You're probably not going to have a whole area that's numb, but you may have, little spots that you can feel, little spots you can't. If you wake up all of a sudden and you have some crazy swelling, or you have bruising that's just increased so much it looks like you're it's causing you swelling, or you start to feel lightheaded or anything like that, you need to let us know. If you have the increased redness along the incision line, I'm just reading from our post-op instructions, which you will actually get. Pretty much, again, that's pretty much it for the body lifts. If you have questions, you can always call us. Let me actually make one more point about the surgery. This is probably not even really the right place to say it in this video, but this is generally the population of patient that has taken Ozempic, Wegovy, Mounjaro. If you are taking those meds still and you're coming into surgery, you actually need to be off of it at least a week before your surgery. The reason for that is because normally when you wake up, normally we give you the instructions and we say, hey, don't eat after midnight before surgery because we got to put that tube in your mouth, and we don't want to make you, aspirate and then suck it back down. You get aspiration pneumonia, meaning you get like food in your lungs and you can get really sick from that. So that's why we have you not eat after midnight. Well, we have a whole new set of instructions because what was happening is people were coming into surgery after taking those meds, and because those meds delay and slow down your gastric emptying, people were going into surgery even though they stopped eating after midnight. They were putting the tubes or the LMAs in their mouth, causing them to gag. They were getting this aspiration pneumonia even though they didn't eat at midnight because they still had food in their stomach. So the Wegovy, Mounjaro, Ozempic, semaglutide, those meds will make you hold food in your stomach for a long time. So the new recommendation is that you have to be off of those for a week before surgery. You can resume them after your surgery. It's just before that can cause some really serious issues with aspiration pneumonia. You don't want to deal with that. So please be off of those for a week. If you have questions, I'm here. You can call us. We walk you through the process. This just hopefully will help you kind of plan for your recovery a little bit, and hopefully give you some information that as a base for coming back and asking us these questions. Thanks for watching. Have a great day.